Hello and welcome to Fundu Money. Here we will be discussing a frequently asked question. Will you be covered for pre-existing conditions in your health insurance policy or pre-existing condition in your health insurance plan? Some people call it Mediclaim or some people call it pre-existing diseases. So the whole crux of the matter is these questions come to us simply because people are wondering whether pre-existing diseases or pre-existing conditions, which is basically if there's a medical condition at the time of buying your health insurance plan or health insurance policy, it doesn't get covered. You cannot make a claim. Claim will not be accepted for a certain period of time. Typically, it's 2 to 3 years. It could go up to 4 years in some cases, in some plans. So this is the period when it is not covered, but that gives rise to a whole host of questions. From what time to what time will it not be covered? Of course, we know this is the period, but suppose you contract a particular condition during after you bought a policy, or you had it before you bought the policy, and how do companies find out about your pre-existing conditions? Which are the ailments or conditions that get covered, which do not? Questions like these keep coming up, and while it's a very straightforward definition, pre-existing conditions, which we just mentioned to you, but this is one of the major reasons why health insurance claims get rejected. So people are naturally wary about it. Now we're going to discuss some of the aspects we just mentioned about pre-existing conditions or pre-existing diseases here, and we'll be doing it through some of the questions which our followers have sent to us, and this will illustrate to you about the timing, about what gets covered, and you will realize that the key part is that if you have truthfully declared your condition at the time and you didn't have one, any particular condition, and it comes up during the course, it does get covered. And if you still have a condition, had a condition at the time of buying the plan and you truthfully declared it, after the period gets over, it gets covered. In some cases there might be a condition which you're worried about, but don't worry. If you keep it for if you stay in the policy for the period when these benefits don't come to you, remember, other ailments, other conditions get covered. Then after the period gets over, it gets covered. Now how will this play out? Now when we are going to discuss some of these questions that have come to us, you'll get to see how it plays out, and you'll get a better idea of pre-existing conditions in health insurance policy or health insurance plans, or Mediclaim as some people call it. So we'll be back very shortly on answering questions on pre-existing conditions in health insurance plans or health insurance policy. Don't go away. Welcome back. Welcome to Fundu Money. We are discussing pre-existing conditions in health insurance plans. So basically, we are trying to answer the questions: would you get covered for pre-existing diseases or pre-existing conditions in health insurance policies? And what are the various things? What are the various variations? Once we discuss some of the questions which our followers have sent, you'll get a sense of what you should be looking out when it comes to pre-existing conditions for health insurance policies, because this is, as we mentioned, this is one of the major reasons why health insurance claims get rejected. So let's jump into it. Let's start answering the questions. I'll be reading them out from a paper simply because they are reasonably involved, and I'll keep providing the answers, and so that you'll get a good idea. So Sayan Chaudhary is asking, so suppose there is no pre-existing disease at the time of taking the policy, and later on, say after 4-5 years of taking the policy, some critical illness is developed, whether the same has to be informed to the insurer, or otherwise any claim related to this will be rejected. Now if there was no pre-existing condition. Now the important thing is you should have truthfully declared. There's evidence to indicate, because you would have undergone some kind of test or something like that. There's evidence, right? And if there was none at that time, then obviously you will you don't have to update the health insurance company. You are supposed to get the claim. There's nothing should be coming in your way. In any case, even if you had a pre-existing condition, this period of 5 years is way more than the exclusion period for pre-existing condition. Remember, this is what is called pre-existing diseases or conditions is called what is called exclusion. You're being excluded from getting a benefit, but you're getting excluded for a certain period of time. So this pre-existing condition should not be a deterrent. It should not prevent you from having coverage. Remember, paying the hospitalization bill from your pocket is going to be very damaging. Whatever investments you make, all the gains that you make will get nullified, because a big hospital bill can really mess things up. So let's take up the next question. Shubham Tiwari is asking, his dad has had epilepsy for 20 years and his age is now 20. Can he get a health insurance policy? Please tell me. Shubham, the companies are going to examine the medical facts, so they'll get all the medical facts, and we think we don't have your dad's health condition in front of us, so it's not fair beyond a point for us to comment. But we think that you are in with a good chance of getting a health insurance policy. They're probably going to take a good look at it. They'll probably say that, okay, 2 to 3 years, maybe 4 years, we're not going to cover. You need to pay a higher premium. That's better than no health insurance coverage. So go for that health insurance plan, the health insurance coverage. But remember, if the health insurance company thinks that your father's medical condition can trigger off multiple sort of medical conditions in the future, they might just modify the policy, or they might think a little bit, something a little more involved can happen if that determines. So much depends on the facts on the ground, and much depends on how the health insurance company is going to look at it, right? So let's look at the next question. So that's by Blind Eyed Gaming. Now the issue here is, in 2016 there was a disease, had the medicine, it got okay. Now suppose in 2021 can an insurance claim be made? Now we are assuming that you have an insurance policy, right? Now we are also assuming that you bought the policy before 2016, because everything will become very different just in case the facts change. Okay, if you say bought it before, if you had the condition after you bought the plan, then there's no problem, because it was not a pre-existing disease or pre-existing condition. If you had this issue and then you bought the plan and you disclosed it, then also it's not an issue, because 5 years and 2 to 3 years is the pre-existing condition issue. Suppose you didn't tell them and this has happened, even then that period has got over. Therefore, again, you should be entitled. So much depends on what the facts are. It's always good to truthfully divulge your health condition, because then you don't get into a mess, because health insurance companies will investigate about pre-existing conditions. So let's get on to the next question. In this case, Blind Eyed Gaming, if you are going to now buy a plan, we think that you have a plan, you have bought a plan. If you're going to buy a plan now in 2021, then obviously with this history, depending on what the condition is, you might be asked to pay a higher premium, and that exclusion period you'll have to see it through, whatever the plan is and whatever the company is, and then you will get a coverage. But our sense is from a question that you already have a plan. So now Meenakshi Das is saying that my father is a brain hemorrhage patient. Now blood clot is normal, but he has physical problems like UTI, sugar, kidney infection. Can you take this insurance? Health insurance? Yes, we do think your father would be getting it, unless there is some condition which people think is going to trigger multiple sort of medical conditions. That we don't think. They might exclude this particular condition for 2 to 3 years and any associated condition, and they said, okay, this is what we are going to give you coverage for, and you might have to pay a little higher premium. It's a good idea to have it, because just imagine you're doing an investment, you're doing everything is going normal, and suddenly you are hit with a huge bill. That's not a good thing to happen. So go for the insurance. We'll strongly encourage you to go for insurance, and also truthfully declare it, and then you're well within your rights to get the benefits over a period of time. This particular condition will also get covered. Now Altaf Allu is asking the question, how do insurance companies get to know what pre-existing disease of insured guys? Well, Altaf, they have a claim settlement department. They investigate. You give the information, you give all the documents and information, they get to know about it. They investigate, they find out, they get an estimate of how much expense you've incurred. Remember, this is a reimbursement insurance. So what you incur the expense, and you're reimbursed for the expense. Now they will determine whether those expenses are rightful or not, and whether they have been what is getting covered with the policy and what is not, right? So this is important. Then last question is Amar Kumar is asking, so does dental illness get covered by health insurance policy? Amar, sorry, on an average they don't get covered. Now, but suppose you get smashed up in a for the want of a better word, you get injured basically in a accident or something, you're likely to get covered. But if it's a regular dental illness you're going, that's not going to get covered. And you can actually find out before buying whether you're going to go to a site, whichever company you're buying. Take a look at the brochure. There is always that there will be a head called exclusion. Go and see which are the illnesses that are getting excluded. That, if you do that, it makes for very informed buying, and we encourage you to do that. But otherwise, on an average, you can assume that it doesn't get covered. So this will give you a pretty good idea of what gets covered and what doesn't get covered, what you are entitled to when it comes to pre-existing conditions. So would you get covered for pre-existing conditions, or yes or no? Some of these answers will give you a very good idea about it. So we hope you found this useful. If you liked it, hit the like button, share it with others, and subscribe to our channel, and wait for our next presentation. Till the next time, take very good care of yourself, and goodbye.